We have a trachea, which is the center pipe, and that splits into two main pipes. From there, it's more of just a bunch of tunnels that go out into the lung. Conventionally, if I was to put a catheter out into these tunnels, I can't really tell where my catheter is going. With this new computer-assisted program, it really directs me the right way to go, and for that reason we're having a much higher success rate with these biopsies. To understand navigational bronchoscopy, we should understand what conventional bronchoscopy is, which is a scope that goes through the vocal cords and into the airway. There's limits to conventional bronchoscopy in that the scope can only really go so far. What we really care about with navigational bronchoscopy is the field of lung cancer. And this allows us to take a camera out further into the airways, and so that we can take biopsies of nodules or lung masses that otherwise were very difficult to access in other terms, and it's a safer procedure. It's one of those things in medical technology that I think is going to advance the field, particularly as it relates to lung cancer. In general, we can use the computer to map out the airway, which gets us within a few millimeters of the lesion that we're trying to target. And so the needle has a lot less distance to travel. To begin the procedure, the patient has a CAT scan, which identifies the mass or nodule or the area of suspicion. From there, we use that computer program, which helps map the right pathway to go in terms of putting the catheter through the different airways. The patient is asleep under general anesthesia. There's an endotracheal tube that helps breathe for the patient with the help of the anesthesiologist. Through the endotracheal tube is a catheter. That catheter is what goes out to the lesions that we're targeting. And then within that catheter, we can actually use our tools in that catheter, whether it's a needle or aspiration or a brush. So once that catheter goes down into the airways and we feel like we're close to the lesion that we're concerned about, we actually then use an ultrasound. There's a catheter that has a small ultrasound on it that we're able to use through the catheter, and we're able to see whether we're in the right location with an ultrasound. From there, we do use a C-arm, otherwise known as fluoroscopy, to help identify how far our radial ultrasound is going out into the lung. Once I take my biopsy, we hand it to our staff, who then actually is able to give a sample to the pathologist who's in the room with us and communicating. They usually tell me one of three things. One thing they'll tell me is, you're in the right spot, I'm seeing atypical things, or you're in the right spot, but I'm not really seeing anything too concerning, or you're not in the right spot and I would consider moving and trying a different location. The robot is creating stability of the catheter. It's also creating the ability to go out further into the lung than conventionally we were able to go before. In general, we should be able to go out as far as we really need to with this catheter because it is so flexible and so small, but it really creates the stability for the procedure. Without that, we wouldn't be able to safely do this procedure. When I look at the most recent cancer statistics in terms of cancer diagnoses and death by cancer, lung cancer makes up, at least last year, 12% of all cancer diagnoses. It also makes up 20% of all cancer deaths. It is the leading cause in this country of cancer death. So there's a disappropriate amount of people who are dying from lung cancer. The treatments are there. In order to improve those numbers, we really have to rely on detection and early diagnosis. This procedure really helps pave the way for early diagnoses, so we can go after smaller lesions to get people at earlier stages, which then becomes treatable to get that number down. We really need more lung cancer screening, which helps with, on the other end, for earlier detection. So the importance of this procedure is really to help improve those numbers because we can be doing a lot better.